I think this will be the last type of what prostacyclin that I'll be looking at. All right, I get to see that this drug, the name is what, iloprost. Iloprost. I think we have looked at treprostinil. We have looked at we looked at treprostinil. We looked at epoprostinil. Now we'll be looking at what, iloprost, right, as the last example of prostacyclin. So they call them what, prostacyclin analogues. So when they say something is an analog, it's just like it's a different version of that thing. You get. So we're looking at it under what, mechanism of action, administration routes, pharmacokinetics, indications, then the adverse effects of the drug. Okay. So for the overview, we see that this iloprost is actually what, a synthetic prostacyclin analog. When they say something is synthetic, that means it's actually what, man-made. You get. So it is used primarily to treat what, pulmonary arterial hypertension. That's PAH. Okay. So let's look at its brief pharmacology, right? So its pharmacology is as follows. For mechanism of action, this iloprost works by what? Dilating systemic and pulmonary arterial vascular beds, right? So when this is it actually dilates a vascular bed, it simply means if this is the size of the blood vessel, this drug can now make the blood vessel as big as this. You get. So it will dilate it, okay? So when it dilates it, this will help to reduce blood pressure in these areas, right? So it also affects what, platelet aggregation. You know, platelet aggregation, that second step, that if there's an injury after vasoconstriction, they have platelets coming together. So the platelets coming together will be what will lead to what? Clot formation. So to prevent that stage, all right? Although the relevance of its effect to the treatment of pulmonary arterial hypertension is not fully understood, but definitely to just dilate, okay? It's just the dilation there, right? So what is the administration route? Iloprost is available in two forms, okay? We have the inhaled form, which is just through the nose or a nasal route. So it is typically what, administered via what, inhalation, to treat this pulmonary arterial hypertension, okay? Therefore, intravenous solution, that's through the vein, it is used for treatment of what, severe frostbite, just to reduce the risk of what, amputation, okay? Then how about the pharmacokinetics? Pharmacokinetics is more of like the ADME, right? A being absorption. So absorption is not determined for inhaled iloprost. Distribution, protein binding is approximately what, 60%. Metabolism, it is metabolized via what, beta-oxidation to inactive tetranor-iloprost, okay? Excretion, it is excreted mainly through the kidneys, about 68%, and to a lesser extent through feces, about just 12%, alright? Half-life, elimination half-life is about just 20 to 30 minutes, okay? Indications, that's which disease condition do we use this drug, right? So it's quite simple. We have spoken about all of them, but we are just trying to see, rearrange your facts, okay? So it is what, indicated for the treatment of this peripheral what, pulmonary arterial hypertension, okay? And this will improve exercise capacity and delay the disease progression. It is also used for the treatment of severe frostbite, just to reduce the risk of what, amputation. All right. So what is the adverse effect of this drug? You have common side adverse effects including nausea, vomiting, diarrhea, headaches, dizziness, jaw pain, muscle spasms, flushing, cough. Right. So more serious side effects can include things like what, low blood pressure and allergic reactions. Okay. So that's it for the pharmacology of iloprost.